Dr. Claudette Reno, it's nice to meet you today. And first, I understand that you're a clinical psychologist, but you have an interest in how nutrition drives our health. But can you tell me about your background as a clinical psychologist, and then how you got into nutrition as part of your clinical practice?
Yes, so I am a clinical psychologist, and during my training, I trained an extra year to work with eating disorders. I was at the University of Kansas School of Medicine. They have a branch in Wichita, and there was an eating disorder facility there. So the training back then in the 90s, as I worked with our program, was that we collaborated with dietitians and other physicians like a psychiatrist. And really the goal was to help anorectics, bulimics, binge eaters to eventually be able to eat all food in moderation. And we were following the advice we'd been told, which was to encourage people to make sure they're eating within an hour and a half of waking up, and that they should really eat 3 meals and 3 snacks to keep their metabolism up, to feel better. And over time, I have now been a psychologist about 28 years, what I found is that doesn't always work. For some people, they can learn to eat all food in moderation and have a healthy balance. But as time has gone on and I've been working more with binge eaters, it just wasn't always working for them to be able to eat everything. And a lot of times it didn't seem like it helped a great deal, and they still were overeating, binging, and almost nobody comes in and says they binge on carrots. It's typically junk food. You know, think pizza, chips, sweets, ice cream, cereal. And a few years ago, I came across Dr. Jason Fung's bestseller, The Obesity Code, and I just happened to read it after seeing a really good review on it. And as I read it, I'm like, this makes sense why so many people that I've collaborated with, other medical professionals and a dietitian to work with, why they wouldn't lose weight even though we were giving them the standard advice, or they would do it for a little while and then they would be back to binge eating on really processed food, especially sugary stuff. And so after reading that, I started to think, well, okay, what about, because I do still deal with anorexia and bulimia, and for some of those people, it does make sense to do some of the old way of recommending to them to work toward all food in moderation, because that does help with their recovery. But there are some people who I believe probably have a food addiction, and I remember after watching a YouTube video that Dr. Vera Tarman, a medical doctor in Canada, she had the treatment center there, and they treat food addiction and other substance addictions. And she had a book called Food Junkies that I read, and that started to make more sense, where she talked about the term food addiction, and that's a little different than like an eating disorder. What she was proposing is that for a lot of people, they can't eat all food in moderation. That'd be like trying to tell an alcoholic you just need to drink in moderation. Frankly, if they could, they would. Most people that work with addictions, and I've consulted at addiction centers, what you find is if they abstain and then they start to drink again, they can maybe do moderation for a little while, and then it's just a matter of time till they're kind of off the rails with drinking or whatever their substance is. Well, I have found that that happens with people who have more of a food addiction, even though in the United States, mental health is governed somewhat by the DSM-5. It's the latest diagnostic and statistical manual for mental health, and they don't accept the definition food addiction. And I was trained that there is no such thing as a food addiction. I've done this a long time, and I believe there are food addictions. So for some people, they can't have sugar or they can't have refined carbs, because when they do, it's just a matter of time till they fall off the wagon and they are binge eating again. For them, it makes so much more sense to have a low carb, higher fat way of eating and staying away from the processed foods, particularly sugar.
So Dr. Reno, as a clinical psychologist, tell me why you believe it's important to come to conferences like this that are all about nutrition.
Well, as I mentioned, being that my specialty is eating disorders, I've always tried to read more information from a therapist perspective, but after I saw Dr. Fung's obesity code, and then I started collaborating with a bariatric nurse practitioner in the area where I live to coordinate treatment and encourage people to have a low carb diet, I learned of the conferences here in Denver, the low carb conferences, and this is the second time I've come with my husband, and it's been so useful. It's like, because it's not, our bodies are whole. Our head isn't separate from the rest of our body, and what we consume clearly affects us physically, but it also affects our mental health. So having learned some of this stuff, when I have patients that are being managed by a medical provider and they're being encouraged to do the higher fat, low carb, what I find, and they'll say too, but it's also noticeable when they walk into my office, is when they are on that kind of a diet, usually their mental health is so much better. They'll come in and say, you know what, I'm not as anxious, or I don't feel near as depressed. I have so much more energy and I can think. For a while there, I just felt like I was in a fog. Now, if they kind of go off the rails, because remember, I'm dealing with often binge eaters, and some of them have a food addiction, so they're craving the carbs, and they try to have a little bit, and sometimes it gets out of control. When they do that for a while, they'll come back in and say, oh, I can tell I'm not doing as well with my eating. I feel more depressed. I don't have as much energy. I just feel more anxious kind of throughout my body. And for a few of them, it is like day and night. You can see the difference in just their overall appearance when they walk into my office. And I don't even have to ask them how they're doing with their eating.
So if you have somebody come to you that presents, let's say, with depression or possibly OCD, maybe even schizophrenia, for example, if you have, take this however you want, but if you have somebody present with some of these common mental disorders like that, what is your first tact? Do you go down a path of nutrition first, or where does counseling fit into this? What's your viewpoint, your gestalt, if you will, about how to approach those kinds of patients? Is there a particular pattern?
Well, okay, so about half of my caseload is dealing with eating disorders, and the majority of them are going to also present with anxiety disorders and depressive disorders, and OCD is an anxiety disorder. And so what I'll typically do is definitely encourage them, if they have not had any kind of a medical checkup, they need to have like a physical, make sure there's nothing physically wrong with them that could be impacting their mental health. And then, especially when I'm dealing with eating issues, I will want them to track what they're eating, track how they're feeling, and if it is like they're overeating and they're wanting to lose weight, that's where I collaborate with the bariatric nurse practitioner, because she'll manage more of the food piece of it. But you know what? You can give people information. That does not mean, especially like as a physician, you can give recommendations. That does not mean someone's necessarily going to follow it. So a lot of times I feel like my job is encouraging them or being an accountability person, where they know when they come in, I'm going to ask how it's going, what they've been eating. If it's not going well, or I notice their mood isn't doing as well, then I will ask things like, so, you know, any binges, what's been going on, what are the triggers? So I'll start looking at what is happening that is setting them off, or encouraging them by going over their own experience or the research, why it's better for them to get back on track with the healthier eating. And for some of them, they're doing intermittent fasting as prescribed by the bariatric nurse practitioner. Again, as a mental health person, I need to stay within my scope of practice, so I am working a lot with the behavioral piece, the mental health piece, but if I have a medical provider, a physician, a nurse practitioner managing them physically around the eating, or a dietitian that believes more in eating this way, then we collaborate, and I'm just encouraging them and I'm helping them to stay on track. And for a lot of them, they'll be like, well, I knew I was going to follow up with you next week, or I had to keep this food and feelings journal because I knew you'd ask about that. And really, for most of us, we need some accountability. For some people, it is enough to give them the correct information and they do well in managing their health.
One of the things that, that I uncovered, which I thought was so incredibly interesting from Weston Price's research back in the 1930s, as he evaluated populations all around the planet who were consuming native traditional diets, and then they westernized their diets and began to develop chronic diseases. But what he also uncovered was that they developed all sorts of mental issues like depression, anxiety, and so forth. And what was particularly interesting to me too was the fact that he noted that many of these societies, like many of the Africans, required no penal system at all. There was virtually no burglary, there was no homicide, suicide, theft, and he related that to their ancestral diet and the fact that these kinds of things changed as people westernized their diet. And we see an extraordinary amount we have a huge need for a penal system in the United States, and we have probably the most processed food in the world. What do you think of this?
Well, you know, I'm not intimately aware of his research, but I don't see how we can't revolutionize a lot of how people are thinking and feeling if just even by changing how they're eating starts impacting them physiologically and physically. Why wouldn't it also be impacting our brain, how we see things, how we feel? And if you're eating in a way that your body works with best, your overall outlook on life is probably going to be a lot more positive. And I'll sometimes see that with people in my office when they are doing well in managing their eating and not feeling out of control and keeping the carbohydrates, especially the refined carbs, down. Their whole perspective is just better. And it's like, so I don't know in terms of the impact on the penal system, but I can say people's overall perspective seems much more positive. They have more energy. I also deal with chronic pain, and some of the people I'm working with, if we can get them to cut back on sugar and refined carbs, what they notice, their pain's better. If their pain is somewhat better, a lot of times their mental health is better because it interacts. Chronic irritability, pain makes you just more depressed and anxious.